Well, new research shows that 1 in 20 people carry a gene for one of 3 life-threatening genetic disorders. So now medical professionals are calling for wider testing and screening for anyone considering starting a family or adding to family. Joining us this morning to talk about what all this means is Dr. Lisa Hansard from the Texas Fertility Center. Dr. Hansard, thank you so much for coming in to talk about this.
Thanks for having me.
So let's talk about the findings from this study that 1 in 20 people may carry a gene that could lead to a life-threatening genetic disorder. That's pretty scary to hear.
It is scary, and I think that one of the things we need to discriminate between is what does it mean to have genetic testing versus carrier testing.
Okay, and what does that mean? What is the difference between the two?
Genetic testing is looking for a gene or an abnormality within your own body that predisposes you to develop a disease.
Okay.
Carrier testing is, do I carry a mutation that has the possibility of causing a serious, life-threatening or debilitating disease in my children?
So we're talking about if you are a carrier of that and you are planning to start a family, that's something that you need to know about and need to keep in mind.
Right, because if you and your partner are both carriers for the same genetic abnormality, that dramatically increases the risk that you will have a child born with a disease like this. And the diseases we're talking about are serious and often lethal diseases such as cystic fibrosis, Tay-Sachs disease, muscular dystrophy, sickle cell anemia, where both parents need to carry the gene. And most parents don't know ahead of time that they are carriers or not because they don't have the disorder themselves.
So both parents would have to be carriers in order to possibly pass this along to the child?
That's correct.
Okay. Now, what if you go in to get screening done and find out that, yes, both you and your partner are carriers?
Well, there's genetic counseling available and then other options based on that. Good Start Genetics is a company that is teaming up with Texas Fertility Center to offer a screening event at a much reduced cost to individuals and couples on December 10th. So our website, texasfertility.com, has all the information for registration of this, and if it turns out you go through this blood test, simple blood test, to see if you're a carrier and find out that you are, genetic counseling is included in that process at no extra charge.
Okay, that's going on December 10th. Obviously, those findings could be very scary for a couple to find out, but would you recommend that all couples planning to start a family get this genetic testing done?
Absolutely. So the American College of OBGYN and the American College of Medical Genetics both recommend preconception screening for all individuals contemplating starting a family. This information, unfortunately, has to get out before a pregnancy occurs. For most obstetricians, once that couple comes to you or that individual comes to you, she's already pregnant. So to do screening ahead of time to be able to make any kind of decision about how do we eliminate this risk, oftentimes it's too late.
If you've already had a child and did not have that screening done, would you still recommend if you're going to be adding to your family then? Absolutely,
because the risk, if you and your partner are both carriers, the risk of your child having the disease is 25%. That means 75% chance that your offspring will either not have any genetic abnormality or even be a carrier, 50% that they'll have carrier status as well.
Okay, very important information. Again, there's an event on December 10th. Where can people go to find out more information?
They need to go to our website, www.txfertility.com, to register for the event.
All right, Dr. Lisa Hansard, thank you so much for coming in this morning. We appreciate
your
time.
Thanks, Lauren. Thanks for having me.